Wozniak. I'm the executive director for Recovery Associates, and I'm a licensed clinical social worker in Florida. Because of the nature of the recovery field, we wear a lot of hats here at Recovery Associates. So the first one is that executive function. The second one is working in the expressive therapies component of our program. And the third is supervising the clinical team. I also work with Lynn Considine in working with people who have experienced trauma and addiction. And this is Lynn Considine.
Hi, I am Lynn Considine. I'm a licensed mental health counselor, and my roles here are varied. And I do work with Paul. We're part of the clinical team that supervises a whole wealth of therapists that we have here. And I also work with Paul on the trauma work that we do with our clients. And I also have a caseload where I work with some of the clients directly and run some of the groups in expressive therapies. And I think today we need to say a little bit about the kind of trauma work that we do with our clients here.
So in the initial assessment process here at Recovery Associates, we work to identify those clients who've had traumatic events in their life, because oftentimes those two things are linked, of course. And what we believe is that we work with trauma in patients in an incremental basis. So we watch when they are ready actually to focus on their trauma. And so we get them grounded in their recovery, and then we use several different modalities in order to address their trauma. And Lynn heads that program, and we'll talk a little bit about those different modalities.
One of the modalities that Paul and I are both trained in is psychodrama, and we believe that's a very safe and effective way to very safely deal with people's trauma. Another thing that we are both trained in is EMDR, and that's eye movement desensitization reprocessing, and a lot of our clients here need that kind of work. So part of the process, as Paul said, is we assess them, we work with them, we get them grounded in their recovery program, and when it's deemed appropriate timing, we start doing some of the trauma work that without that kind of work, they would be at a much higher risk for relapse. So in our program, we want to have a whole approach where they have a solid program and they've dealt with the emotional issues that have triggered their addiction in the first place. And we should also mention that along with that, we work very high in close correlation with our psychiatrist, who is looking at medications, looking at psychiatric issues, and following up on anything that needs to be done in a medical way.
And so I guess the core of what we do with trauma work is building a safe environment here. And so we really know that people don't do real work unless they can feel safe enough to do it. And so we really the underpinning of everything that we do in trauma work here at Recovery Associates is built on building that safety net for all of our clients.